IOL removal complicated by the presence of a capsular tension ring. This was a patient with anterior PVR with ciliary body detachment and hypotony. Prior to anterior base dissection, the IOL was planned to be removed. This previous lens surgery was done at an outside hospital with no available records, and the presence of a CTR was not previously noted. Initially, the light pipe was used to push the lens and the capsular bag into the AC. However, there was significant immobility of the lens in the capsule. The lens was then rotated as shown into the AC, cut, and removed through the clear corneal incision. When the capsular bag was attempted to be removed by grasping onto the anterior capsular edge, significant tension was noted, and the capsular bag was very immobile. We attempted to proceed slowly in order not to shred the remaining anterior capsule. Initially, this was thought to be due to strong zonular support. A vitreous cutter was then planned to be used to remove the zonules with a second hand. However, instead, the capsular tension ring was noted. With the second hand, forceps were used to grasp the CTR. Then, the same intraocular scissors were used to cut the CTR. Forceps were then used to rotate the CTR out of the eye.